Occupational health policy development. Definition. Policy. Rules designed to guide decisions and achieve rational outcomes. It acts as a framework within which an organization or government operates. Formal, written guidelines, occasionally informal practices, that shape behavior and decision-making. Essential for providing direction, consistency, and accountability in various domains. Types of policies. Public policy. Laws, regulations, and actions taken by governments to address public issues. Guide and shape societal outcomes, such as health, education, and national security. Examples include environmental regulations, healthcare policies, and education reforms. Organizational or workplace policy. Specific to organizations, whether public or private. They set rules and guidelines for how the organization operates and how employees should behave. Examples include HR policies, safety policies, and IT policies. Social policy. Promote the well-being of the population, particularly in areas like healthcare, social insurance, housing, and education. Aimed at reducing inequality and providing social safety nets. Examples, SSS/GSIS, Pagibig. Economic. This includes fiscal policies, taxation and government spending, monetary policies, interest rates and money supply, and trade policies. Examples, income tax, VAT. Environmental policy. Focus on protecting the environment through regulations and laws aimed at reducing pollution, conserving natural resources, and promoting sustainable practices. RA 6969, GHS. Security policy. Security policies are designed to protect individuals, organizations, and nations from threats. This includes cybersecurity policies, national defense policies, and workplace safety policies. Health policy. Health policies guide the healthcare system, including the delivery of care, public health initiatives, and health insurance programs. The need for policy. Consistency. Policies provide a consistent framework for decision-making, ensuring that similar issues are handled in a uniform manner. Guidance. Policies offer direction and guidelines for behavior and decision-making, helping individuals and organizations know what is expected of them. Accountability. Policies establish clear expectations and consequences, which help hold individuals and organizations accountable for their actions. Efficiency. By setting clear rules and procedures, policies streamline processes and reduce confusion, leading to more efficient operations. Identifying needed resources. Risk management. Policies help identify and mitigate risks, whether they are related to safety, security, or legal compliance. Policy development process. Problem identification. Identify the issue or need that the policy will address. This could be a societal problem in the case of public policy or an operational issue in a workplace. Research and analysis. Gather data, analyze the situation, and explore potential solutions. This step involves consulting experts, reviewing existing policies, and understanding the impacts of various approaches. Consultation and stakeholder engagement. Engage stakeholders who will be affected by the policy. This could include public consultations for government policies or employee input in a workplace setting. Drafting the policy. Develop a draft of the policy that outlines its purpose, scope, and guidelines. In public policy, this might involve writing a bill or regulation. In a workplace, this could be an internal document outlining procedures. Review and feedback. The draft policy is reviewed by relevant parties, such as government agencies or organizational leadership, to ensure it meets its objectives and is practical. Approval and adoption. Once the policy is finalized, it is formally approved and adopted. In government, this might involve passing legislation. In workplaces, this could be done through executive approval. Implementation. The policy is put into action. This may involve creating new processes, training employees, or setting up enforcement mechanisms. Monitoring and evaluation. After implementation, the policy's effectiveness is monitored and evaluated. Adjustments may be made if the policy is not achieving its intended goals. Introduction to Occupational Health Policy. Definition and importance. Occupational health policies are formal guidelines that govern health and safety in the workplace. These policies aim to protect workers from health hazards and promote a healthy work environment. For occupational health physicians, these policies are critical tools to ensure the safety and well-being of employees, prevent work-related illnesses, and promote long-term health. Role of occupational health physicians. Aware of illness, injuries in workplaces. Knowledge of OSH laws and guidelines. Knowledge of existing workplace policies for alignment with proposed policies. Coordination with stakeholders in the workplace, management, HR, safety and health committee, unions, etc. Networking with colleagues. 2. Framework for policy development. Prevention focused. Policies should aim to prevent injuries and illnesses before they occur. This involves identifying potential hazards and implementing controls. Risk assessment. Identify and prioritize hazards that need to be addressed through policy. Health promotion. Policies should actively promote health and well-being, including mental health and wellness programs. Policy development models. Public health model. This model emphasizes prevention, using data and research to guide policy decisions. Participatory model. Involves collaboration with employees and stakeholders, ensuring that policies are practical and widely accepted. Legal and ethical considerations. Occupational health policies must comply with regulations. Ethical considerations include ensuring fairness, protecting confidentiality, and balancing the needs of the employer with the rights of the employees. 3. Steps in policy development. 1. Needs assessment. This can involve reviewing incident reports, conducting workplace inspections, and consulting with employees. Analyzing existing health data. Specific needs of the workforce. Engage stakeholders, including management, employees, and unions, to ensure comprehensive input. 2. Policy design. Policies should have clear objectives. S. Specific. M. Measurable. A. Attainable. R. Realistic. T. Time-bound. E. Evaluate. R. Review. Draft the policy with legal requirements and best practices in mind. The policy should be clear, actionable, and easily understood by all employees. 3. Implementation strategies. Develop a detailed plan for rolling out the policy. This includes timelines, responsibilities, and necessary resources. Training and education are key to successful implementation. Employees need to understand the policy and how it applies to their work. 4. Monitoring and evaluation. Set measurable goals and regularly monitor the policy's effectiveness. For example, track the number of incidents before and after the policy is implemented. Be prepared to make adjustments as needed. Continuous improvement is essential to keeping policies relevant and effective. 4. Key areas of focus in occupational health policies. 1. Workplace health and safety. Policies should address hazard identification, control measures, and emergency preparedness. This includes protocols for personal protective equipment, PPE, machine safety, and fire safety. Hierarchy of control, elimination/substitution, engineering, administrative, PPEs. 2. Occupational health services. Ensure that employees have access to medical surveillance, health screenings, and management of work-related injuries and illnesses. Policies should also cover the provision of occupational health services, such as flu vaccinations or health assessments. 3. Mental health and well-being. Mental health policies should address workplace stress, burnout, and harassment. Offering employee assistance programs, EAPs, and promoting work-life balance can be integral to these policies. 4. Ergonomics. Ergonomic policies should aim to reduce the risk of musculoskeletal disorders by promoting proper workstation setups, safe lifting techniques, and adequate rest breaks. 5. Environmental and sustainability policies. Consider policies that address environmental factors such as air quality, noise control, and waste management. Promoting green workplace initiatives can also enhance employee well-being. Department Order No. 198 Series of 2018. Implementing Rules and Regulations of Republic Act No. 11,058 entitled An Act Strengthening Compliance with Occupational Safety and Health Standards and Providing Penalties for Violations thereof. Occupational Safety and Health Program. The OSH program, which shall be duly signed by the employer, must include at least the following. 1. Company commitment to comply with OSH requirements. 2. General safety and health programs, including safety and health hazard identification, risk assessment and control, HIRAC. Medical surveillance for early detection and management of occupational and work-related diseases, and first aid and emergency medical services. 3. Promotion of the following health domains. Drug-free workplace, RA 9165. Mental health services in the workplace, RA 11036, and healthy lifestyle. 4. Prevention and control of the following health domains. Human immunodeficiency virus and acquired immune deficiency syndrome, RA 8504. Tuberculosis, EO 187-03, and hepatitis B, DOLDA May 2010. 5. Complete company or project details. 6. Composition and duties of the OSH Committee. 7. OSH personnel and facilities. 8. Safety and health promotion, training, and education, to include the following. Orientation of all workers on OSH. Conduct of risk assessment, evaluation, and control. Continuous training on OSH of OSH personnel, and work permit systems such as working at height, working at confined space, hot works, and other related activities. 9. Conduct of toolbox or safety meetings and job safety analysis. 10. Accident/incident/illness investigation, recording, and reporting. 11. Provision and use of PPE. 12. Provision of safety signage. 13. Dust control and management, and regulations on activities such as building of temporary structures, and lifting and operation of electrical, mechanical, communication system, and other equipment. 14. Provision of workers' welfare facilities. 15. Emergency and disaster preparedness and response plan to include the organization and creation of disaster control groups, business continuity plan, and updating the hazard, risk, and vulnerability assessment, as required. 16. Solid waste management system. 17. Control and management of hazards. 18. Prohibited acts and penalties for violations, and 19. Cost of implementing company OSH program. The DOL shall prescribe a format that should be accomplished fully by the employer, contractor, or subcontractor, if any, in consultation with the workers and their representatives. The OSH program shall be communicated and be made readily available to all persons in the workplace. It shall be updated periodically whenever the DOL, other regulatory or government agencies and institutions promulgate new rules, guidelines, and other issuances related to workers' safety and health. V. Challenges and barriers in policy development. Organizational resistance. Resistance to change is a common challenge. Effective strategies to overcome this include involving stakeholders early in the process, clearly communicating the benefits of the policy, and providing support during the transition. Resource constraints. Budget limitations can hinder the implementation of certain health policies. Demonstrating the return on investment, ROI, in terms of reduced absenteeism, lower healthcare costs, and improved productivity can help justify the necessary expenditures. Cultural and behavioral challenges. Workplace culture can greatly influence the success of a policy. Promoting a culture of health and safety requires consistent messaging, leadership support, and reinforcement of positive behaviors. Definition. Types of policies. The need for policy. Policy development process. I. Introduction to occupational health policy. 2. Framework for policy development. 3. Steps in policy development. 4. Key areas of focus in occupational health policies. V. Challenges and barriers in policy development.